Welcome to Pharmacology lectures. Now we are going to study about Bethanecol. It is an unsubstituted carbamoyl ester. Now you have to remember somewhat medicinal chemistry because it is usually appearing in if you are appearing for exams, you have to remember these things. And its structure, it was related to acetylcholine, but what was the difference? There was an extra branching and an amine group was added in the beginning. It is not hydrolyzed by the esterification, although it is inactivated through hydrolysis. Okay, it has strong muscarinic and weak nicotinic activity. Actions: increase motility, bladder muscles are stimulated, which will produce urination. What is the therapeutic use? In neurologic treatment, Bethanecol is used to stimulate bladder, particularly in postpartum or post-operative non-obstructive urinary retention. Adverse effect: Bethanecol adverse effects are generalized cholinergic stimulation, sweating, salivation, flushing, decreased BP, reflex tachycardia, nausea, abdominal pain, diarrhea, bronchospasm. That's why it is not of much clinical importance. Atropine may be administered to overcome serious bronchoconstrictor and cardiovascular adverse effects. Okay, this is an antidote. You have to remember this. These are some diagrammic representation of adverse effects with cholinergic agonist. You will face diarrhea, diaphoresis, that is increased salivation, and meiosis, pupil constriction, nausea, urinary urgency due to the action over bladder muscles, detrusor muscles. The next drug we are going to study is Carbachol. Carbachol has both muscarinic and nicotinic actions. Carbachol is also an ester of carbamic acid such as Bethanecol. Now actions: it has cardiovascular actions and on GI systems. It will cause the release of epinephrine from the adrenal medulla by its nicotinic actions. It is usually locally instilled into the eye and it mimics the effect of acetylcholine. So it causes pupil constriction. We can see here pilocarpine, carbachol, and atropine. All these drugs, when you treat with pilocarpine or carbachol, pupil constriction will occur. And its antidote we have also studied, atropine. Its effect will be opposite, mydriasis, dilation of the pupil. Now therapeutic effect of carbachol: because of high potency and long duration of action, it is rarely used because it is not cleared. Adverse effects: few. If we are using we will use only for local effect, ophthalmologic, so its adverse effects are rarely seen. It does not penetrate into systemic circulation.